I'm a fellowship trained breast surgical oncologist. I'm Dr. Amani Jambakar, and here are 3 things that I would never do as a breast cancer surgeon. Number 1, I would never get a thermogram. They are simply not as effective as mammograms at detecting breast cancers early. I have seen patients who have had negative thermograms only to go on and have a mammogram after they still felt a lump in their breast, and the mammogram led to additional workup, including a biopsy, which showed that they did in fact have cancer. If they had been getting regular mammograms instead of thermograms, this cancer could have been caught and treated much earlier. Number 2, if I felt a lump in my breast, I would not let any physician or NP or PA tell me that it was normal or a cyst without ordering imaging. I can't tell you the number of young women I've seen who had a lump like this one and were told that it's probably fine, and then months later the lump was still there, and then they had a mammogram which looked like this and showed a big cancer. No one's physical exam, not even mine as a breast expert, can replace getting imaging like a mammogram and an ultrasound to make sure that a lump in the breast is not cancer. And number 3, if I had a family history of breast cancer or ovarian cancer, I would not put off risk assessment by a high-risk breast clinic with a surgeon like me or a medical oncologist or another physician or PA or NP who specializes in that. So I actually do have a family history of ovarian cancer. My grandmother had it, and even though she was older when she had it, it still qualified me for genetic testing, which I got done several years ago, and thankfully it was completely normal. To me, a high-risk family history means having any family history of breast cancer or ovarian cancer. You should be evaluated by a specialist to see if you meet criteria for genetic testing, and if you don't meet criteria for genetic testing, they should tell you what your lifetime risk of breast cancer is and whether or not you would benefit from something like breast MRIs or possibly starting screening earlier than the age of 40.